If you've been using cannabis as a tool for intentional consumption alongside other medications like antidepressants or birth control medication, you've probably wondered at some point, are there interactions between my medication and cannabis that I should be aware of? In today's video, we're going to explore how cannabis can interact with common medications and what you can do to make sure that you're using it safely and intentionally. Hi, my name is Tabitha Fritz. I'm the founder of Level Up and I'm a cannabis educator. I have worked with a lot of different people to help them learn how to integrate cannabis into their holistic wellness routine so that it's both thoughtful and intentional and improves the quality of their overall human existence. So today we're going to take a look at some common interactions between cannabis and other medications and how you can take a look at any medications that you might be taking and whether or not they interact with cannabis. I'm going to show you a pretty cool tool that is available online for you to look up any medication that you might be taking to see how it interacts with different cannabinoids, THC or CBD, so that you have all of the information that you need to make the best decisions and the best choices to live your best life. This is going to be more of a research video. So I've done a lot of research on this topic. I'm not a doctor, I'm not a medical professional, but I'm really good at learning stuff and presenting the stuff that I've learned in a way that other people can also learn from it. So I've done a lot of research on this video and I have a lot of things to share with you. There will be a lot of links in the description of the video. So if you have questions about things that I've shared or you want to know more information, please check out the links in the description to get more. Everything that I'm going to share here in the video today, it comes from research. It is research based. I did not make it up. I did not come up with these ideas myself. I'm just putting them together into a format that hopefully you can consume and use to make the best choices for your own life. Okay, so the three main topics that we're going to cover in this video today are how cannabinoids like THC or CBD can interact with different medications so that you know how those interactions can occur. We'll talk about specific considerations for antidepressants and birth control pills. Now, obviously, there's a gazillion other medications that you could be on, but I know those are two quite common ones from people who potentially could be watching this video. So those are two things that we will talk about specifically. Then I'm going to give you some practical steps and a tool that will help you make sure that your cannabis use is safe and effective alongside your medications. Of course, there will be some medications that cannabis is contraindicated for, that you shouldn't be using weed at all. So it's important to know all of those things so that you can take that information to your doctor and have a conversation with them about what it is that you are taking for your health. Okay, so let's get into it. Let's start by talking about some different cannabinoid interactions, and we're going to speak specifically about CBD, THC, and CBG. You may have heard of the grapefruit drugs, right? Sometimes you will be prescribed a medication and on that medication there will be a warning that says like, do not consume grapefruit while you are consuming this medication. And the reason is because grapefruit has this enzyme in it that actually changes the way your body metabolizes certain medication. That can lead to too high of a level of that medication being in your system. Like the medication didn't break down quickly enough because of this enzyme, and therefore now you have the levels of the medication in your system are too high. They're higher than they need to be. CBD can have the same effect. It's got a similar enzyme in it that can prevent those specific drugs from breaking down. Okay, so if you've got a drug with a grapefruit warning on it, you probably shouldn't consume CBD along with it either. You definitely want to speak to your doctor about that before you start consuming CBD with it. The levels of that medication in your system are too high. You have an increased risk of side effects. Whatever that medication is, like most medications, there's the potential for side effects that come along with them, right? So if you are taking more of that medication than your body needs, you are increasing your risk for experiencing those side effects. So that's one thing to be aware of when it comes to consuming CBD. Now, when it comes to THC, it's a little different. THC doesn't impact necessarily the way that drugs metabolize, but it will impact your overall experience. I recently had dental surgery. I had an implant that was removed and then a bone graft that was put in. And my doctor, so he and I, before the surgery, we were talking about what is it that I need to do to manage my pain. And I had had a procedure, like 6 months, 8 months previous, and I'd had a lot of pain with that procedure. I, called my dentist and been like, you need to prescribe me something stronger. Like, I am not having a good time. So when it came to the second surgery, we had a discussion ahead of time that was like, listen, we really need to think ahead of time about how I'm going to manage the pain if this is as painful as the last surgery was. And so the conversation that I had with my doctor, my dentist, he said, listen, I'm going to prescribe you oxycodone, which, is a very strong painkiller. And I said, what about THC? Because I hadn't really used THC before to manage my pain. And he said, first of all, I'd rather you use THC to manage your pain. I'd rather you use cannabis than oxys to manage your pain. He knew that I'm a cannabis educator. So he said to me, I assume you're pretty familiar with doing that and you know how to do it. Like, you know how much to take. I was like, yeah, don't worry, I got it. And so he said, first of all, I'd much rather you take cannabis than oxys for pain. If you're able to manage it with cannabis and ibuprofen, do it. He said, but do not take cannabis with the oxys. Because, and this is the reason that he told me, he said THC can absolutely potentiate the sedative effects of some medications. And oxys are one of those, right? So anytime you've got a medication that's going to provide a sedative effect anyways, whether, it's a sleeping pill or a pain medication or whatever it might be, THC can enhance those sedative effects a lot, right? Potentially even to the point that is not safe anymore. So if you are consuming, a prescription medication, especially if it's a painkiller or a sedative or anything like that, you definitely want to speak to your doctor before consuming THC along with that product. And then the third cannabinoid that we'll talk about is CBG. So CBG is a newer cannabinoid. It hasn't been on the scene quite as long. Research is still emerging about CBG, but it does seem to interact with medications that affect blood pressure, can potentially lead to hypotension, which is like your blood pressure is too low. You just pass out all the time because your blood pressure is too low. So we don't have real definitive information about CBG and its interactions with medications yet. And the tool that I'm going to show you later actually only covers CBD and THC. It doesn't also cover, unfortunately, CBG. But this is, if you're on a medication, especially that affects blood pressure in any way, that's something that you definitely want to think about. Speak to your doctor about it. Say, can I consume CBG with this? Your doctor probably won't know, but your doctor will, potentially be able to guide you into finding some more information on it as well. Okay, so those are the cannabinoid interactions that we'll just cover in this video. So CBD, THC, and CBG. Now let's talk about some specific medications that you may be on. And first, we'll talk about antidepressants. One of the most common forms of an antidepressant is an SSRI. And there are some concerns with using an SSRI and THC because THC is a molecule that mimics naturally occurring endocannabinoids in your system, like 2-AG or anandamide. And anandamide, also known as the bliss molecule, is a serotonin regulator. So combining THC with SSRIs like Prozac or like some other ones can potentially lead to occurrences of serotonin syndrome, in which your body has expressed so much serotonin that it is having a challenge producing more. I would like to say that at this point, clinical analysis on that is pretty scant. Like, there's not a lot. I did see a little bit of that in the literature. I also saw, different studies in which the results of that varied. But I did see some studies in which that was suggested as the outcome. So if you are taking an SSRI, it is important that you know that THC does seem to have shown the capability to limit enzymes that are responsible for SSRI metabolism. What that means is that there is some chance that combining THC consumption with SSRIs could lead to serotonin syndrome. Now, this is not, established well in the literature. There's not a lot of examples of this occurring. In the examples that occurred, there were potentially other mitigating factors that happened as well. So I'm not saying that if you consume an SSRI and THC, you're going to get serotonin syndrome. That's not at all what I'm saying. But what I'm saying is that there is the potential for that to happen when there are 2 or more serotonin boosting drugs in your system. And THC is a serotonin boosting drug. Okay, so there's a potential right there for some issue. And so it's just something to be aware of. If I were consuming an SSRI and I wanted to consume THC, I probably still would, but I would keep my dose really low to start. I would not consume a high dose of THC. And I would be sure to talk to my doctor about it, right? I would talk to my doctor and be like, listen, this is what I'm doing. I know there are some concerns. I just want to be upfront. And I would also really keep track of how I was feeling, of how those things, both the SSRI and the THC, were impacting my mood, impacting how I felt. If I noticed a pattern of not feeling well or starting to feel worse, I would discontinue my THC usage, certainly. It's really just about being aware of it so that you can make the right choice for you. Okay? Be aware of it, keep track of your consumption, keep track of your experience, and then you can look back and reflect and see if there are patterns that are emerging over time so that you can make the right choices. Now, when it comes to CBD and antidepressants, we have a different effect with CBD. It's similar to the grapefruit drugs. For some drugs, CBD can impact their ability to break down, metabolize in the consumer's body. So it can lead to higher levels of the antidepressant in your body over time. Not true for everyone, not true for every experience, but it's certainly not true for every drug. But that is something to be aware of as well. Okay, so not as many interactions with CBD, but the potential for challenges or problems are there as well. And then the other drug that we promised to cover in this video is birth control. And so far, there do not seem to be any known interactions between cannabis and birth control. Cannabis does not seem to impact the effectiveness of birth control, that's the main thing. Right? The effectiveness, which is great. So the thing, though, that you do want to consider and maintain an awareness of are mood considerations, right? So mood can absolutely be affected with hormonal birth control because you are changing the way the female body naturally has a 28-day hormonal cycle, right? You're just basically making it the same all throughout the month. So that can have some mood impacts on people, especially if they're sensitive to hormonal changes or hormonally based changes, right, in their own body. So if you are consuming cannabis along with that and you are, seeing big mood swings or you're having big mood changes, that would be something to be aware of and, talk to your doctor or your healthcare provider or whoever it is that you talk to about your birth control and let them know that you're experiencing that, right? And you may need a different form of birth control. You may need a different brand, a different kind, whatever. Or it may just be that cannabis does not have a good interaction with that for you, right? We're all unique. Our bodies are unique. We got to listen to our own individual bodies because they tell us things. And I can't tell you what your body's telling you. Only you can hear what your body is saying, right? So you have to be the one who tunes in and listens. As promised, I'm going to show you a tool that I came across that shows whether or not a drug interacts with THC and CBD. So I will put it here on the screen. All you're going to do, it's through Penn State College of Medicine, an amazing resource. You can choose different languages. So there's quite a few different languages available. I'm going to choose English because that's the language I speak. And then I will search. I'm going to accept the terms. And I identify as I'm a patient. Sure. Okay, so now here I've got THC at the top, I've got CBD at the top, and I've got THC and CBD over here. So I'm going to choose what is it that I want to consider. And for each of these, there are some different choices. So for THC, you can choose Delta 9 as a therapeutic class. So just THC overall in general. These down here are medical applications of THC. So if you are prescribed THC as a patient, you could potentially be prescribed one of these products. And so in that case, you would select this specific product to help you understand more. Now, if I wanted to do CBD, again, I would choose CBD as a therapeutic class, or I could say as a non-prescription oil. Or I could do, if I was prescribed CBD by a healthcare provider, I would choose this one at the bottom. And I can do both THC and CBD, so as a therapeutic class or for adult recreational use, which is probably most of us. Medical cannabis, if someone's been prescribed, it's medical cannabis. THC, CBD, mucosal spray, which again would likely be prescribed to a patient. So I'm just going to pick Delta-9, THC, and CBD as a therapeutic class. Now, let's say I am, what would I say before? Prozac. Okay, so let's search Prozac. Whoops, I'm going to click it. I'm going to add it. Okay, so now I've got Prozac loaded in here, and all I have to do is click Analyze. And it's going to tell me there, THC and CBD and fluoxetine, which is the drug that Prozac is, have no known drug-drug interactions according to CANN-DIR. So according to this database and this research tool, there are no known interactions between Prozac and cannabis. So I would be okay to consume it and to use it, right? I gave you some general things to think about beforehand in terms of increased serotonin in your body or drugs breaking down from CBD. But this is a pretty good tool and a pretty good resource that's going to allow you to make more informed decisions about using cannabis with different drugs that you may be on. So if you're looking to incorporate cannabis into your wellness routine safely, you can definitely use this tool to help you do it. Okay, so I'll link the tool along with all of my sources down in the description of this video so that it's easily accessible for you. Please use it because it's an amazing tool, and I'm recommending it to everyone now that I know who is on medication and also consumes cannabis, because it's important to have all of the information that you can when you're making the best decisions for yourself. That's what intentional cannabis consumption is about. Making the best decisions that are in alignment with what it is that you want to do with your life and with your holistic wellness, with your overall wellness. That's what this is about, making sure that you're meeting your body's needs and doing it in a safe way, right? So thank you for joining in. I hope that you found some value in this video, that you got some tips and tools about what to do. And remember, it's important that you stay informed and always consult with your healthcare professionals about your medications and cannabis. I've given you lots of information here today that will help you make the most informed decisions for yourself. I'm not a doctor, I'm not a nurse, I'm not a trained healthcare professional, I'm an MBA. So do not necessarily take my advice at face value. Take my advice as information that you can incorporate and use it to make the wisest decisions for your own body going forward. I'll see you in the next one.